Governor Cuomo, for ending AIDS in New York. Thank you, Governor Cuomo, for ending AIDS in New York.
My name is Mark Harrington. I'm the Executive Director of Treatment Action Group, and I'm very proud to be standing here today with a coalition of community leaders, organizers, and activists who have persuaded Governor Andrew Cuomo to release the first ever in any jurisdiction worldwide plan to end the AIDS epidemic within the next 10 years. Governor Cuomo has just released a 3-point press release about his new initiative, which has 3 pillars, the first of which is to expand HIV testing and get everyone linked to care, the second of which is to get everyone who's HIV positive and wants to be on treatment onto effective, successfully virologically suppressed treatment, and the third is to greatly expand the state's promotion of pre-exposure prophylaxis, or PrEP. We have a couple more requests to the governor in building this historic success, and one of them is to quickly name a high-level task force to put together the rest of the elements of what's going to be needed for the plan. I want to emphasize one of the key victories that the governor has achieved, which is that by negotiating with pharmaceutical companies, he has gotten rebates from 3 of the major pharmaceuticals that will result in massive savings to the citizens of New York and allow us to be able to afford to put the rest of the New Yorkers who need HIV treatment on therapy. And so, if, for example, pre-exposure prophylaxis is now $12,000 a year per person, thanks to the governor's rebates, it will probably cost about 1/3 of that, which means we can prevent new infections in 3 times as many people with the same amount of money. This is building on Affordable Care Act, on the governor's very ambitious Medicaid expansion, and it couldn't have been done without all of the activists that have been involved in this struggle for the last 30 years.
I'm Matthew Bernardo. I'm the Chief Operating Officer for Housing Works. So on behalf of Housing Works and the entire Housing Works community, I applaud Governor Cuomo and his courageous and bold commitment today. In making ending AIDS epidemic in New York by 2020 a state priority, the governor confirms that he is a staunch advocate for people living with HIV and AIDS. With this momentum, we can end AIDS as an epidemic in New York without a cure. Any successful state plan will use today's cutting-edge science to drive down new infections by keeping people with HIV healthy. But to truly succeed, no one must be left behind. The initiative will need to reach high-risk groups where new infection is still startlingly high. People of color, men who have sex with men, and transgendered women. Toward that end, many non-medical interventions will be equally crucial. Some of these efforts already have begun, such as the 30% rent cap that was put in place by Governor Cuomo and Mayor de Blasio recently. We must also ensure people already living with HIV have access to housing, work opportunities, and other supports that allow them to live their lives whole. So on this LGBT Pride Day, we commend Governor Cuomo for bringing the New York State fights to end AIDS to a new plane, just as he did marriage equality, and look forward to working together to bring an end to the AIDS epidemic in New York by 2020. Thank you and happy Gay Pride.
There are still 22,000 New Yorkers who still don't know whether they're HIV positive or not. And today's announcement hopefully will address that issue and bring these people into treatment. I think we have the science, we have the technology to solve this crisis. The fact that Governor Cuomo has recognized your call to action is a testament to his foresight and understanding of what our community wants. We can solve this problem by 2020. The scientists say we can solve this problem by 2020, and now the political leaders are saying we will solve this problem by 2020. We have to stay vigilant, though. As Mark mentioned, we do need a task force assembled so the activists and the educators and the scientists can monitor the success of this program. We also need to make certain that young people, particularly men of color, 18 to 24, are tested so we can bring them out of the shadows and into treatment. It's all about being treated, and that's why I'm so enthusiastic about the governor's support of pre-exposure prophylaxis, which will stop the virus in its tracks. So the announcement today is a great moment for our community. We have come a long way. It's a testament to all of your work, and it's a testament to the memory of the over 100,000 New Yorkers who have died of HIV/AIDS, and we remember them today, and we honor them.
On this LGBT Pride Day, I greatly applaud Governor Cuomo for boldly leading in our 3-decade-long fight to end the AIDS epidemic. We have the science and means to bring HIV infections below epidemic levels. And with the governor's and Mayor Bill de Blasio's smart leadership, we can end AIDS in New York by 2020. HRA is now implementing the 30% rent cap that was mentioned earlier, which makes housing affordable for people with AIDS here in New York City. And it was agreed to by the governor and the mayor in February, and is a key part in our effort to save lives and save money. Today's game-changing action will push other leaders in the U.S. and beyond to take the necessary steps to end the HIV/AIDS epidemic for all. Thank you.
Today, while we are heartened by the progress we have made in confronting the AIDS epidemic in New York State, we know that we still face an epidemic of crisis and unacceptable proportions, especially among young gay men, men who have sex with men, in the transgender community, and among Black and Latino women. We believe an effective plan to end AIDS will focus on strengthening care systems and meeting, not dismissing, the needs of people living with HIV. An effective plan also will make smart and strategic investments in prevention, investments that have a real chance to slow the epidemic down and end it as we know it by 2020. We believe that an investment today in routine screening and universal access to care and treatment will pay an unprecedented dividend tomorrow. The governor's leadership and announcement today moves these ideas from rhetoric and platitude to action. For now, we know that any plan to end AIDS in New York State must include an evidence-based combination HIV prevention strategy for both HIV negative and HIV positive persons. We need aggressive prevention efforts, all the while focusing on the drivers of the epidemic, including homophobia, stigma, and lack of housing. At Harlem United, we are particularly hopeful of the promise of PrEP, holds as a powerful part of combination prevention and as a means to slow new infections in our communities.
It is fitting that we are here today on the 45th anniversary of the Stonewall riots, which became a rallying cry to fight back against social injustice. This weekend, the governor heard our rallying cry to commit to ending the HIV/AIDS epidemic by 2020. With strategies like improving access to PrEP and PEP, the plan to end AIDS can result in a dramatic decrease in new infections among men who have sex with men and transgender women, especially within low-income communities of color, some of our hardest hit populations. On behalf of GMHC, I applaud the governor for his decisive leadership and commitment to end AIDS as an epidemic, and we are proud that he has joined us in our collective work.
We would like to applaud Governor Cuomo for not only recognizing that we have the tools and the know-how to finally end the AIDS epidemic, but for committing to using them in order to end the epidemic in the state of New York. Governor Cuomo's bold pledge to end the epidemic in our state by the end of this decade could become a model for the rest of the country and the rest of the world. Even without a cure or a vaccine, Cuomo understands that we could drastically reduce new infections below epidemic levels and ensure that all people living with HIV achieve optimum health. HIV remains to be a severe crisis in both the LGBT community and communities of color. In New York City, a majority of new HIV diagnoses are among gay and bisexual men, with Black and Latino youth at highest risk. While HIV has touched every population and age group in New York, 79% of people living with HIV/AIDS in our states are people of color. A central goal of the governor's plan will be to increase the number of New Yorkers living with HIV who have access to treatment to obtain viral suppression, which is important for long-term health and reducing the risk of transmission.
Years ago, I returned to HIV work after doing other things for a decade and a half. When I learned of the alarming rise in new HIV infection among queer youth, gay guys, especially guys of color, and transgender women, I, like so many of my colleagues here today, work for a world in which no young person, no human being has to go through the pain, confusion, guilt, insult, fear, and self-recrimination that those smart, beautiful, talented, loving, and one-of-a-kind young people have to go through all the time. I believe that New York State's support of the community-initiated plan to end the HIV epidemic and the significant reduction in the price of drugs for HIV treatment and for HIV prevention that's a part of this program is an important, necessary first step in making that dreamed of HIV world the world we really live in.
I want to personally thank the governor for bringing forward this plan. I won't repeat what many people have said, but I will mention that there are a few notable components of this plan that haven't been mentioned. One is the partnership with community and with private industry. Some people have talked about the concessions in drug prices from some of the pharmaceutical industry. That's just one of a number of components of this plan that was developed in partnership with critical stakeholders. Another thing that I wanted to mention was the fact that the governor's plan builds on aspects of the Affordable Care Act that guarantee universal access to health care. It also builds on Medicare and Medicaid reform. These are critical components to ensure that everyone has access to health care, and that's something that at the United Nations, where I work, is one of the critical factors that we're trying to build in to the post-2015 development agenda. All of those factors, actually. Access to affordable medicine and access to universal health care is something that we need to have not only for people living with HIV in New York, but for all citizens around the world. And the governor's leadership is showing the importance of these critical factors, and I applaud him for that.
A friend just recently told me a story. He was walking down the street and he ran into a person he hasn't seen in a while. He told this person, "I've just started pre-exposure prophylaxis. I've made the decision to take care of my health." As he was telling the person the story about starting on PrEP and what it could do for him to protect him from HIV, his friend became visibly upset. He asked him, "What's wrong?" And he said, "I've just tested HIV positive. If I had known about this intervention, maybe I wouldn't be standing here today." Every day that some person tests HIV positive in New York State, it reminds us that our system is broken. It reminds us that we failed someone who could have been prevented from acquiring HIV. So I'm here today because I want to thank the governor for taking leadership, hearing our calls to roll out this plan to end AIDS in New York State. I want to be able to tell my children that the AIDS crisis is over. Thank you.
Yay!